There's been some confusion recently about what test to order when imaging the lungs. So this is just a brief video to explain what tests we do and why we do them. There are only really three areas of the lungs that we're concerned about when we're imaging with a CT scan. The first would be the area of the pulmonary arteries right over here. The second would be the area of the lung parenchyma over here and over here. And the third would be the aorta, which is over here and then runs down behind the back of the lung. So the blood that comes out of the pulmonary arteries comes out of the right ventricle, leaves the right ventricle through the pulmonary arteries, and then essentially shows the pulmonary vasculature. So the only area you're looking at first off is the blood that comes out of the pulmonary arteries, which is this area that you see right over here. In this area, the thing we're primarily worried about would be pulmonary emboli. And the reason we're concerned about that is a pulmonary emboli starts over here, somehow it gets into the right ventricle, and then it gets shot up through here, or through here, and it goes behind the aorta and ends up in the pulmonary vasculature of the pulmonary arteries right over here. And what happens is it blocks this area over here and pretty much blocks everything downstream, over here and over here. What's particularly concerning would be a saddle pulmonary embolus, because as you know, a saddle pulmonary embolus essentially will come out of here and then block this and block this. So essentially, a saddle pulmonary embolus will block all outflow out of the right ventricle because it blocks both sides of the pulmonary arteries as it comes out of the right ventricle. You know, in order to visualize the different parts of the lungs that we talked about, the pulmonary artery over here, the lung parenchyma over here, and the aorta over here, what we do is we change the timing of when the injection begins and when we start scanning. So if we want to look at the pulmonary vasculature as it comes out, so for example, we're looking for a pulmonary embolus, what we do is we start the IV over here. The IV contrast comes in through the veins, comes in through the right atrium to the right ventricle, and then starts to come out. Once the contrast is in this area, so you've got a high concentration of contrast in this area, that's when we start the scan. And the reason is once the contrast is here, we start the scan going back and forth. Actually, it circles, but that's a whole different story. Going back and forth while it's in this area over here. And the reason is we want slices through that area when there's contrast there, because the contrast will make the pulmonary emboli show up that much better. Now, because you're actually doing a pulmonary angiogram, what that becomes is we call it a CTA, which stands for a CT angiogram. All right, so let's say we're looking for a tumor, which means that we're looking for the area in here in the pulmonary tissue, in the pulmonary vasculature, basically the lungs. Again, please excuse the Morris High School marching band in the background. So let's say we're looking for a tumor in the lungs over here, right, or any place in the lungs. So what we do is we start the injection of the contrast. The contrast comes up through here, goes down into the right atrium, goes in the right ventricle, comes out of the right ventricle through the pulmonary arteries, down all the way into the lung parenchyma. Now, the contrast will actually start to dilute over here, so what happens is your bolus of contrast ends up in the lungs, and it's significantly diminished because the concentration is decreased in this area and in this area. So now notice what's happened. You now have pretty much no contrast in the area over here and over here, but you have a significant amount of contrast within the lung itself. So now when the contrast is inside the lung itself, but not in the pulmonary arteries and not in the aorta, that at that point in time is when you start your scan. So the scan starts, you run your scan through this, and because the contrast is in the lungs, right, but not in the aorta, and not in the pulmonary arteries, you highlight the lung parenchyma. And that would be a CT of the chest with contrast, because you're not really concerned about the pulmonary arteries and you're not really concerned about the aorta. So that's a CT scan with IV contrast. You're looking for tumors in the lungs or some sort of masses or something else in the lung tissue itself. You're really not concerned about the pulmonary arteries and you're not concerned about the aorta. So I'd like to briefly, because it wasn't clear before, give you the idea of the concept of a bolus. So the bolus comes out of the IV, and think of it as a bolus that moves along. So your bolus comes along over here, all right? And at that point in time, the bolus is inside coming into the right subclavian and coming into the superior vena cava over here. So now the bolus continues to move along. It's pretty much out of there, and now it lies inside the right atrium and to the right ventricle. And it's going to continue to move along over here through the pulmonary arteries. Now it moves along into the pulmonary arteries, here and here and here. And it's in the pulmonary arteries, which is what you're concerned about when you're looking for a pulmonary embolus. So when the contrast is in that area, in the pulmonary arteries, that's when you fire up the CAT scanner, and that's when you start taking slices through that area. And again, you're primarily looking over here and here because the contrast is there, and that's where you're looking for a pulmonary artery. So now the bolus continues, it's out of the pulmonary artery, and the bolus is now living in the lung parenchyma here, here, and here. And notice that there's no longer really any significant bolus in the area of the pulmonary artery, and there's certainly none in the area of the aorta. You can see now that the bolus is living in the lung parenchyma, and that's just about the time if you want to look for tumors. And this is a CT of the chest with IV contrast. Then as the bolus is moving along, you're going to start up your CAT scanner and you're going to scan through it over there. So what you'll do is you'll pick up the areas of the lung, which is what you're looking for, and notice that there's almost, in fact, assume there's no contrast in the pulmonary embolus, right? It's going to be in the pulmonary arteries or in the aorta. So you've timed your bolus such that you're picking up the lung parenchyma and essentially nothing in the pulmonary arteries or in the aorta. So the bolus continues to move along. It's no longer in the pulmonary the pulmonary vasculature. The bolus has now moved along into the left atrium and the left ventricle, and it lives there for just a little bit, a fraction in time. Bolus comes out of the left ventricle and now lives in the aorta. So here, and most importantly, comes down over here. So that's where your bolus is now. So now that your bolus is inside the aorta and you want to see what the aorta looks like, now's the time to fire up your CAT scanner, and then you start your scan when it's in the bolus is inside the aorta. Now, a couple quick things to notice is that even though you've shot through there, there's no contrast inside the lungs, and there's no contrast inside the pulmonary arteries, as we discussed earlier. So the only place you really do have contrast, and the only place you're interested in, is the aorta over here. All right, let's do a brief review of the difference between a CTA, which is a CT angiogram of the chest, a CT with IV contrast, and a CT aortogram. So when the bolus lives in the pulmonary arteries, here, and here, that's when you fire up your CAT scanner. You're looking for a pulmonary embolus because it's a CTA, and you're looking for the area in here. That's a CT angiogram of the lungs. When the bolus lives in here, you fire up your CAT scanner over here, and that is the area you're interested in. You fire it up over here. That's a CT of the chest with contrast. So finally, when the bolus is in here, 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 here in the aorta, and down over here in the aorta, and you have a cat meowing in the background, you fire up your CAT scanner over here, and you start shooting this area over here, and you're looking at the aorta. That's a CT aortogram. Hope that makes the distinction between all three of those tests clear.